So when you're a resident, you have to park on the roof in the Dallas heat. And so it's like 100 degrees and your car's like 140 degrees inside and you can't touch anything for like 10 minutes. But when you become a fellow, you also park on the roof. It sucks. So while my car is cooling down, I got the AC running. I thought we'd do a quick little video here on the roof while I let that cool down. So let's go over 5 traits that make a good resident. All right, we're gonna go off the dome here, off the top of the head. So I'm just gonna give you 5 that I think make a good resident. So apply these, do these. If you're a new resident, if you're a seasoned resident, you're not doing one of these, go ahead, start doing it, be a better resident. So number 1 is you work hard. You just put your head down and you do it. A lot of it sucks. A lot of it's grunt work. A lot of it's stuff nobody else wants to do. But you have to just realize that everybody who is ahead of you, fellows, attendings, that looks like they may be having it easier than you have it or feel like they do, they went through it at one point. So it's just something you have to suck it up and do a lot of times. It sucks, it's not fun, but you do it. So good residents, good trainees know how to put their head down and work, you know. They don't get abused, they don't get taken advantage of, and you stand up for yourself when you need to, but you got to put your head down and work. So that's number 1. Don't be a complainer. All right, number 2 is you have to be inquisitive. You have to want to learn. Don't come off as somebody that knows more than you do know, or even if you do know a lot of stuff, don't come off that way. You can learn more. Trust me, the people ahead of you almost certainly know more than you do. Or if not more, they know something you don't know. So shut up and listen. Don't be rude. Don't be cocky. Don't be arrogant. Don't pretend to know stuff you don't know. That's number 2. So it's smart too. If you're really smart, you'll shut up and listen. You know, the person talking is generally not the most intelligent person in a room. So the one listening is. So listen and learn. That's the wiser thing to do. So that's the second thing. All right, number 3 is to practice. You got to practice this shit, guys. You can't just show up and do it, especially when it comes to the operating room. You can't just show up and think you're going to be able to learn it doing it in the OR. So go home, practice, and do deliberate practice. If you don't know what deliberate practice is, go YouTube it, go Google it, figure out what it means to do deliberate practice, and start doing that. It's not practicing in a way where you're doing your suturing at home, or you're just passively learning. You have to use active recall, you have to use spaced repetition, and you have to like physically practice things. You have to apply these concepts if you're going to be any good. So do that. Deliberate practice. That's number 3 for good resident, good fellow. Number 4, know what the hell's going on. So when you're calling somebody, you know, to talk to an upper level or talk to a fellow or talk to an attending about a patient, have a plan. Get yourself out of the med student mindset of just being a data gatherer. That's not what you're doing as a doctor. The whole value in you being a doctor is problem solving and reasoning. So formulate a plan, and if you're presenting it to somebody, tell them that plan. So don't just be a data gatherer. Go ahead, formulate the plan, and you know, if it's not dangerous to do so, enact the plan, and then you get feedback on how your reasoning works, how your plans work. So take your thinking, your critical thinking up a notch. Don't be a data gatherer. Be an enactor of your plan and formulate plans. Learn to think critically. That's what you're doing in residency. That's what you're learning to do in training. So learn to do that. All right, number 5, good resident, good fellow, gets along with people and gets along with everybody, more or less everybody. You get along with the techs, you get along with the fellows, you get along with the other residents, you get along with the attendings. You're not a difficult person to work with. So be easygoing. Don't be so high-strung that, you know, you're just impossible to work with, guys. So do these things. Things I'm talking about are simple. They're not complicated, but you do have to do them, and they're not easy. You know, they're not necessarily easy things to do. They're simple. They're not easy. Those are different things. So implement these things Simple things, not necessarily easy, but if you want to be a good trainee, you want to get something out of what you're doing, put these into practice. All right, that's 5-minute rooftop talk while the car cools down. Maybe there's some benefit to parking in 1,000-degree weather up here. All right, leave a like, subscribe to the channel. Zach with Dr. Eyeball MD. I'll see you guys in the next